Hello again, everyone. Hope you are doing well. So this week, we're going to be taking a look at your poster. But before we get into that, a couple things. I am doing a second round of edits on your ARP2 paper. So some of them I was able to do a deep dive on. Others, I was trying to kind of get them back to you as quickly as possible with highlighting some initial areas to address. And so I want to, again, continue to serve in the role as a reviewer, somebody who would be potentially reviewing your paper if you submitted it to a journal, and to kind of ask those questions that a reviewer might ask, somebody that maybe doesn't understand the topic to the same degree that you and your committee members do. That being said, coming up the week of September 23rd, don't forget you're going to be wanting to touch base with your chair of your committee. And again, each week you're trying to work a little bit on making those edits and trying to improve the overall presentation. Let's talk now about the poster. Now, this says 2023 on it. It is the information that was provided to last year's class. I will upload it into Canvas so you can check things out that way. It was the material that kind of guided people preparing their posters. And so instead of redoing it all together, well, I can't redo it because it's in PDF form, but that's why it says 2023 on it. But the material in here is good, and this will get you prepared for your symposium poster presentation in December. So your medical poster, you've probably seen these at conferences, and if you haven't, in the future when you go to a medical conference, there's always a time that's devoted to poster presentations. And during those poster presentations, people walk through the area, and if they see something that grabs their attention, or if they find a particular title that pulls them in, they want to check it out, maybe ask you some questions. So your medical poster will help to contribute to medical knowledge. And so in doing so, you're furthering people's understanding. The one thing that really amazes me is even 25 years in, there are things that I continue to learn within orthopedic and sports physical therapy. One, there are new ways of doing things or better ways of doing things that we find in the literature. There's new surgeries that are done, and so there's different ways to do rehabilitation. But then on top of that, there's just so much information that posters are kind of like a way of getting the word out. Because if you can share it with one person, maybe that person goes on and shares it with another, or maybe you get 20 people to check out your poster. So it is a very common way in a professional meeting to share research findings. Medical posters have that educational value to them, and they can potentially highlight the need for change in clinical practice, or how we diagnose things, or our prognostic approaches. So as I was mentioning before, this is kind of the standard setup in a large meeting where there are boards, and you'll have something similar to this when you do your symposium in December. So as you see here, there's posters usually put on each sides of the boards, and so people then snake their way in and out of the different posters. Again, oftentimes ahead of time, they may know particular topic areas, and so they might congregate towards those areas, or they just might kind of walk through and peruse, kind of, window shopping, so to speak. And if something catches their eye, that pulls them in. So that's kind of an important thing to think about, is what in your poster is going to catch the eye of the passerby. Now, applying the poster, you want to obviously try to get it up so it's looking even, so it has a nice aesthetic appearance to it. And usually pins or Velcro are used to apply them into the appropriate spot. The design process. So my experience has been, if I'm the first author on a poster, I do all of the work, and then I get feedback from my contributors. But you can also do things differently and have people kind of take on different parts. Probably the easiest thing for you to do in this process is for you to create the poster and then get feedback from your committee. You're going to see in the examples that at the top of the poster is going to be the title, the listing of the authors, and the affiliations. You're going to be able to use information from your manuscript to create the poster. It says here, do not cut and paste paragraphs. That's true, but there may be key lines that you can cut and paste. Ultimately, you don't want to just have the poster be a dump of words, because if it's a dump of words, the person can either A, just read that, or B, my experience is it's not that attractive, so you don't want to really engage with it. And that's what we're trying to do, is come up with something that has a catchy title, something that is aesthetically pleasing with the use of images, different figures, different tables, and the just right amount of words. Now, you're going to need to submit the poster by the deadline for printing, and so take a look at the course syllabus to see when that is. It's in November at some point in time. Obviously, before that period in time, you want to get a checkoff from your committee. And then practice your presentation. Well, what does that mean? Start thinking about questions that people might ask. Probably the most common one is, tell me about your study. What were the findings you had? I don't know much about X, Y, or Z. What is that? People might not have an appreciation for the treatment that you're investigating or the diagnostic approach. And then the process from there is just working with and communicating with those individuals that are interested in your topic and having that conversation. Now, here are the general sections, and we'll see some examples coming up in just a bit. How many of these sections you use will be dependent upon what you and your committee think are appropriate. For example, I might include an introduction section, but not a background information section. Same thing with pertinent elements. I might not have that in there. The review of literature, that's kind of like your methodology. And so can you quickly summarize in 2 or 3 sentences how you found articles for your scoping review or systematic review? Also, within that review of literature could be the results section. I don't see listed in here a results, but how can you, either in a figure format or in a table format. Now think about the tables within your review paper so far. These are gigantic tables. So those may be very difficult to cut and paste into your poster. But how can you recreate either a table or recreate a figure that illustrates your key findings? So that's kind of be your challenge. The discussion section may be a general paragraph that highlights what's known, what's not known. Conclusion section, future research, that kind of speaks for itself. Again, we'll take a look at some different examples here, and that will inform, ultimately things are going to be informing what you include and what you don't include. References, it's ideal to have references on your poster. And if you use references like a superscript 1, 2, and 3, then you need to list those references. I've seen some people use smaller font. I've also seen some people use those QR codes, and if somebody was interested in accessing a reference list, they could then use their phone, access the QR code, and collect the reference list that way. Acknowledgements listed here as optional. I don't think that needs to be on there. Flow of your poster. Posters should be a visual description of your work. Again, need enough details so that your audience can understand the clinical significance of your, not case report, but of your scoping review or systematic review. And again, be succinct with your text. Now it says consider using, instead it should be, you should use figures, pictures, diagrams to help explain your reviews. Use a good color scheme. Here, the former instructor was suggesting leaving about 40% white space. Again, as you look at it, as you create it, does it feel overwhelming? Don't use a background of graphics that will be too distracting. Sometimes people will have a background that might be a full figure of itself, and that is very difficult to look at because it's hard to sometimes pick up the words. 3 to 4 columns total. Again, the effective poster, get somebody's attention and get them to talk to you. Title, don't use all caps. Make sure it is centered. Use the title of your manuscript. Authors. So you should be the first author. You're the presenter. And then the last author is typically your committee chair. And then all of your other committee members should go in there too. Where it says here, obtain permission from all authors, again, that is meaning you want to get checked off by all the authors that they are approving its presentation. And at the bottom there is an example of an affiliation. So we see one there, it's listing the PA students who were involved, and then Dr. Gambini, who is the former coordinator of this series, and then listing the George Fox Doctor of Medical Science program. If you have members from other groups, other affiliations, whether they are inside or outside of George Fox University, those should be listed also. General recommendations for font. So, this is interesting here. I oftentimes go with Times New Roman, I think it is, just because that's my go-to, but these look like these might be some interesting ways to go to. Sans serif. Dr. Gambini feels that that is better for reading from a distance, and then other ones include those listed there, the Calibri, Tahoma, and Arial. True, the font needs to be read from 6 feet away, and so you want to have something that is large font versus a smaller font. Don't use colors as the background for graphs or figures. Use a few colors that go together. Tables and charts are great. You can see some examples of good tables and bad tables, or good charts and bad charts there. And basically, it's how overwhelming is it with colors? How overwhelming is it with additional stuffs? Is it too busy? If you have the pertinent information there, then a discussion can be created. For example, on the bad chart there, I don't know what each of those individual boxes there are representing, the 4.3, the 2.4, the 2, and so forth, but you know your data, and so you would be able to discuss what that means. It looks like the 2 maybe is just illustrating the height of the red box, the 2.4, again, that height of the gray box there. It's a little overwhelming. People can see it, and if they have a question, they can say, hey, is that a 2.5? Is that 2.75? You can be able to let them know that. Pictures. Pictures are appropriate. Don't use a picture that includes somebody that you don't have permission to use. Should not use an actual patient picture. Of course, our particular situations don't have that. Be careful about stretching pictures. So you see the bottom there, it just looks a little more awkward. Some more things on visuals. Looking at the size there, you will read this first. So those types of things can grab people's eyes when they are kind of skimming through a poster. If something's smaller, if it's harder to read, people are not going to necessarily read that. Again, you're trying to catch somebody's attention. So colors can do this. Bolding can help to do that. Size can help to do that. So here are some examples, some good ones and some bad ones. I think you can appreciate that this may fall into the bad category. Too overwhelming. Here is another one that probably falls into the bad category. There's so much there that the passerby may not want to stop and look at it. And on top of that, they could just read it. Maybe they're not interested in actually engaging with you. And I think that's what's really valuable about the poster sessions is having a conversation. Otherwise, why even bother standing there? Just have your poster up and have people read through it. It's that interaction, I think, that's most fulfilling. Here is something that is described as an appropriate example. Now, I might argue that there is a lot of text there. Maybe too much. Here is another one that is considered a good example. I think there is a good amount of text here, but there's also a lot of different tables and figures, things that can create discussion. All right, so if you have questions, don't reach out to Dr. G, reach out to Dr. B. So I'd be happy to look at things and discuss things, but more important, your committee members are going to be the final ones that check things off for you. And so this should be just like you're working on your papers, should be something that you work on closely with them. These are just some final tips here for the day of poster presentation. It says stand to the left. I don't know that that matters. Of course, introducing yourself. And then you can read through the rest of those there. All right, this is some information from Dr. Gambini, and then I'll also include some of my experiences when appropriate. Oh, okay, so if you were to go to a professional meeting, you can take a look at this here and check that out. This isn't really important stuff for the symposium per se. You can pause the recording and read through this if you choose to do so. And that is the end of this section.